We're back for our next departmental budget discussion. Councilman Russ Pulley stepped in here for a minute, but I think he must have stepped back out. I'm Mayor David Briley, and I'm joined by Talia Lomax O'Neill, the city's finance director, who is to my left, and Emily Pacini, who is the chief of staff here in the mayor's office, to my right. Before we jump into next year's budget, I just want to make a couple of comments about last year. As you know, about this time last year, we became aware that our budget was going to be difficult, and we wouldn't be able to do everything we wanted to last year. Nevertheless, we hunkered down, I guess you would say, and found a way to live within our means, and that, in conjunction with some increased revenue this year, is giving us the opportunity to do a cost of living adjustment for our employees, and the open range and step increases that we had wanted to give last year. I hope our employees see that as a sign of appreciation for their hard work over the last year. So everybody is getting a raise this year in Metro. Our next budget discussion is with the Hospital Authority's CEO, Dr. Joseph Webb. And before he introduces his colleagues and compatriots who have joined him today, I just want to say I think there's been a lot of hard work that's taken place over at General Hospital in the last year. I occasionally get updated on it, and whereas a few years ago there may have been a lot of worry about the accuracy of the numbers even, today I think there's a high level of confidence that we know what's going on, and even though we all have identified improvements we can make, we sort of see a path forward and see the opportunity to make those improvements. So thank you for your hard work over the last year. And with that, I'll turn it over to you, Dr. Webb.
Thank you, Mayor. And to my right is our board chair, Joel Sullivan, and to my left is our Chief Financial Officer, Bruce Naramore. I want to just take a second just to express thanks to you on behalf of the hospital and our board for support that you've given us, as well as the council. The funding, the resources that we received previous year, not only put us in a good position to meet the operational needs, but we're also able to get a better cash flow, and I think we'll be able to return to stable footing once again. We did achieve over the year a Joint Commission survey successfully. We have also started to expand our footprint in the community, as you probably heard in the media, the Edgehill Clinic, which is a partnership with the MDHA executive team, and also the big event was the food pharmacy, which is addressing the food insecurity need in our community, which is expressly done to meet the nutritional needs of that population. So thank you very much for all the things that you are doing, and we look forward to our hearing today. And I'm going to actually allow our CFO here to get started and introduce the budget.
I was going to say that was going to be a short one. We'll just skip right over the numbers, go to the end. Is that right?
Right. We've already previously provided our fiscal 2020 budget request for the hospital. I know Talia, on every Wednesday call, we talk about where we're performing this year, and I'm going to beat her to the punch. I think that we're projecting that we would probably turn back something in the $400,000 to $500,000 range. I think if you look at the last monthly cash flow, a couple of points though I'd make on that just before I commit to that is that we have about $1.1 million still outstanding state dish funds that we expect to get $550,000 at some point this month or early next month, and another one before the end of the fiscal year. So the timing of those payments, which have been very steady for quite a few years, is the one qualifier I put on that. And I just say that for the group. I know we've talked about that before. I just want to make sure that's out there. Okay. I wish billion. No, about 1.1 million. But the budget we put together today was it was developed by our whole administrative team. It was originally approved by our board at February 28th Hospital Authority meeting. And then obviously shortly after that, we updated for the months of January and February. And so we made some minor tweaks. And so I think the request that we sent back in mid-February was probably 44.8, and the one that we present today is 44.9. It's about $40,000 more than the original, and that's just budget rounding and so forth. There's nothing significantly that changed, but there are some small adjustments. People have come on and gone off staff. Some contracts have been updated, and so we adjusted them for real time. Hospital, just overall, our inpatient volumes in 2019 have declined, inpatient volumes slightly, but that's a national trend. It's not unique to Nashville General. Actually, the hospital and Meharry Medical Group, we both added and or replaced some of the physicians that were lost late in 2017 and early 2018 when there were conversations about converting the hospital to ambulatory. That physician loss impact on our patient volumes has been significant. Many of the volumes that we have, particularly in orthopedics, general surgery, and in the ancillary departments of radiology and laboratory, are significantly tied to an adequate supply of specialist MDs and mid-level providers. So we're working to shore those up. There are focused recruitment efforts that are reflected in this budget, ongoing by both the hospital and Meharry, to grow primary care provider base and shore up coverage in areas of general surgery, oncology, orthopedics, and a few other subspecialties. So with those sort of assumptions and initiatives, we budgeted in 2020, we assume a 4% growth in our inpatient volumes over 2019 and a 3% growth in outpatient and clinic volumes. We, like the metro departments, we have projected a 3% increase in wages. We don't have step increases at the hospital. The only thing we have is the annual COLA that we provide. One of the other benefits that we had of sort of the mayor's office and the council's support for stabilizing the hospital is we've finally managed to start putting a dent in contract labor at the hospital. It was running almost $400,000 a month, so these are nurses and ancillary staff that are not employees of the hospital, but contracted through outside agencies, and they're twice as expensive as a staff person. And so we brought that number down from over $400,000. In fact, it was a little almost $600,000 one month in 2018 or 2019 fiscal year, and in February it dropped to $220,000. So that's about almost a 70% decrease in that cost. And so we are able to hire people with a little bit of stability at the hospital, and we're able to start driving down those contract labor costs. So we appreciate that support. Benefit costs in this budget are based on our current costs and probably will be adjusted when Metro determines what the health plan benefits and pension costs should be budgeted for 2020. There are some increased costs in the budget this year. The first one that's significant is we assume a full year of the cardiology contract coverage with Vanderbilt. That used to be a Meharry contract, and the hospital picked it up mid-2019 fiscal year, and so it's reflected for a full year in 2020 budget. We also have a full year. We employed our own urologist. We lost the contract provider from Vanderbilt. He was a 2-day-a-week urologist. We now have a urologist on staff employed 5 days clinic a week, and so that's reflected in the salary dollars. And we have a new primary care physician that will be joining the hospital in June timeframe, so that salary is also reflected. I would just say we are extremely thankful, and there's a celebration tomorrow because you guys were kind and generous enough to grace us with $2.4 million of capital last year. And tomorrow, we're putting in 60 patient beds that we purchased with part of that money. We also have 114 patient infusion pumps that will be delivered on April 11th. Those two purchases will save the hospital, and it's reflected in this budget, $640,000 a year in rental costs. So that is much appreciated. You probably heard me talk about that for 18 months, so I do appreciate it. So the anticipated subsidy need that's reflected in the budget here for this year, 2020, is 44.9. It's a decrease of about 1.2 million from the current 46.1 that were budgeted for 2019. I would just say we believe these results are achievable. I'm conservative. I'd like to think we could achieve these numbers. The physicians getting in place is probably the biggest driver to our success. The stability around the hospital for the last 12, 14 months has been a grand benefit to us in our ability to recruit and retain staff, and the same when we're recruiting physicians to come into the hospital. It's a benefit to us all, and that's whether we're recruiting or Meharry is recruiting. So we do believe these results are achievable. We know there's a lot of moving parts. We're a hospital. We're not just a traditional agency of Metro. We depend on $15 to $20 million of state and federal money to support us each year, as well as the city supplement, as well as our own generated $42 million, and we're projecting a slight increase there. So then I'll just say the other thing I point out on the expense side of the hospital, our salaries, you can see, are rising about 5.5%. That's more than the 3%, but that's because I'm converting those contract labor staff into regular wage positions, and then the two physician additions to salaries that are significant, as they make more than a standard employee would. And then note that contract labor is budgeted to drop from almost $4 million this year to $2.4 million next year. So when you add those three lines together for salary, wage, benefits, our total costs and salaries are up less than 2% next year in total. Our supply costs really increase based on volume and a 3% inflation for supplies, 5% inflation for pharmacy. You probably know that pharmaceutical costs rise faster than CPI in other areas. Our contract services are rising just slightly next year. This actually reflects referral of patients outside the hospital that we pay for services at Vanderbilt, St. Thomas, other places for a service that we don't provide. We might have provided in the past, and we might have lost capability to do that because we don't have the physician there anymore. And so we're working on that. As we bring more in, we hope that referral cost will go down. The other impact there is just a parking garage escalator that we rent from Meharry. Has a 2% escalator on it each year. And so that's the other part of contract services. Our physician services line, you can see, is going up a little over $1 million. The majority of that is the cardiology contract with Vanderbilt. That's about $560,000. I'm also projecting that as Meharry is bringing on more physicians, and we pay Meharry for the professional fee care that they provide to those indigent patients, that as they bring more physicians in, we will start to pay them for the care of those patients, pointing back to the numbers that we probably paid Meharry for those services back in 2017 when they had a fuller complement. So those are the two big impactors on that line. Other expenses are really driven by our hospital building lease, and so you see interest expense moving around, and that's just the amortization of the $4 million a year payment on the hospital building itself. Some of it goes to interest, just like your house note. As you get closer to the end of that lease, then more and more of that money goes towards the principal and less towards the interest expense side. So that's the request for this year, and I tried to do it quickly, and I know you're going to have some questions. Go ahead.
Get caught up with you on which document you're using, Bruce. We had an earlier version. Both versions are in the mayor's materials.
Okay.
Was it the 44-920-063?
Yes.
That's
Okay.
the most recent.
That's the most recent one. So
Yes.
when you mentioned to the mayor a $1.2 million difference.
It's going from 46.1 to 44.9.
Okay.
I'm sorry.
Okay, so what's that, 40?
Was that a question? I'm sorry.
Yes.
She's asking me a question.
Yeah, he was explaining to me what this was,
That's
but
the
then I
difference
said, what's the
between
difference,
the-
what's the
it's between-
840 that
it's
I'm
between
seeing
the
here?
45,760,089 and the 44,920.
The projected?
Between projected.
And not budget?
Hang on a second. I'm looking at a different one.
I just want to make sure we're looking at the same thing.
One
So,
second.
yeah, that doesn't add up either.
Yeah. Just
The
wanna
next to
clear-
the last column.
Yeah, because, correct.
Right.
45,760, I'm sorry, Talia.
Yeah.
Yeah.
Yeah,
The
that's what we're trying to get to.
45,760 is projected, but that's not allocated. The allocated is 46,1.
Okay.
And so I told you that we'll probably finish better than 46,1. So that's the difference between
Yeah,
those two.
that's why I
Yeah.
just kept looking at it. I
That's
couldn't
okay.
back
I'm
into
sorry.
it.
When I referenced 46,1, that was what was allocated in the budget. 44,9 is the request.
Okay.
But I think we're going to finish around 45,7. So the 44,9 is
Okay.
840,000 less than that.
Okay.
Okay.
In terms of the pension, the benefit board has taken action on that, and pension for next year will be flat. Okay, and we will be, and the benefit board will be taking action on health benefits on Tuesday. So
Okay.
we'll be able to tell you on Tuesday.
Yeah. And as soon as you share those, obviously we'll make that adjustment. But that's too.
Unless something unexpected happens, that's likely to be flat as well.
That's fabulous.
Okay, so I'll keep you posted on that.
I want to just, I want to frame something real quickly for you. Over the last 3 years, we have been able to show a continuous trend reduction in the subsidy that the city's taxpayers have afforded to the hospital. You know, that's in reverse of what's happening in the national trend in healthcare, with a $3.5 trillion spend in healthcare, and that's almost 20% of the gross domestic product. But what our budget that we're putting into place, the resources that we're putting into place will help us to continue to trend downward. So a portion of this is strategically being done to make sure that we can continue to deliver on that reduction, and then we don't get caught up in the national trend and reversing to escalation in healthcare costs.
Let me ask, so assume that the numbers turn out like you think, and there'll be 1.1 million, I think is what you said, to that in reduction from essentially last year's or this current fiscal year's subsidy. How much cash on hand would that leave you with at the end of this fiscal year?
Well, last year I think we finished with right at just about 5, but we had
Just about 5
Right. So for
million.
us, we have really no operating cash like traditional hospital. We're more like an agency, frankly, even though we fund things ourselves. So we have 30 to 45 days of accounts payable is usually about $3 million just in the normal scheme of things at the hospital. And our payroll is about 1.3 million plus the taxes and so forth are another 300,000, rough numbers. And so typically, if you have 30 days of accounts payable, 40 days of accounts payable, plus a payroll coming due, like we have at least the last 2 years, that's about 4.5 million. So that's why I say we will probably, and she sees the cash flow sheet every time we have this call, and we're projecting that we will probably finish June 30th with about $5 million roughly in the bank at that point in time, snapshot. But then 2 days later, I've got to fund a payroll that's going to be 1.6, and I've got accounts payable that are constantly flowing. So I tell her every week when we have our calls, I say, Talia, I'm not going to draw down money that I don't need because I would rather the city keep it and invest it. Right? I'm a finance person. Even though I represent the hospital, I am with Talia on that.
But I don't know. A few years ago, the hospital would have had 0 at the end of the fiscal year, right? And would have had to be having to negotiate with everybody about where you're going to pay, and the CFO's job was not managing money; it was managing vendors, right?
Yes.
And so having some money is a positive.
Yes, it is. It absolutely is.
My second question is about the depreciation and amortization line in the budget. How much of that is amortization and how much is depreciation?
Well, the only real amortization we have is the building lease, and that's, that's the most significant number. The majority of that, so I would guess it's about, for next year, it's probably about, and Bill's back there, probably about 3.5 million is depreciation, and about 1.5 is amortization, or is it 2.5?
1.5.
1.5?
Yes, 1.5.
Is amortization.
Yeah,
So then 3.7 or something like that is depreciation. But that's a non-cash expense, right?
Correct.
And the subsidy treats that as a cash expense, doesn't it?
no.
The way
No,
it's
if you,
added
in
up
fact,
there?
Mayor, we put it on here because people want to reconcile back to the income statement, but it is not a cash item, so it is not factored into the 44.9. It's just there as a reference number.
Well, I don't understand that then, because
I know.
I could be totally, I'm being a lawyer here, trying to be a mayor, trying to be a
Accountant.
lawyer, trying to be an accountant. So the net margin is $3.9 million,
Correct.
right?
Correct. And the principal payment on the lease is the next cash item.
Right, but you go from 3.9 to negative 1.287 by adding in the depreciation, right?
Correct.
And then you add the 1.287 to the 42, and that's how you get to what the supplement should be. And once you add in, that's how you get to 44, though, right?
Well, I'll just walk you through. The depreciation doesn't actually factor into the subsidy need. I know it's represented here on this sheet. If you take the 3.9 net margin, that's the margin we have at the hospital from an operations standpoint. Don't pay
Right.
any attention to depreciation. And go down to the 2.7 because that's a principal payment, so it's like your house payment. It's towards principal, so it's not an income item, but it is a cash item. And so it leaves us with basically a $1.2 million cash profit for the year. Now, we might have talked about this last year. It might be a flashback.
Yes, I'm having a flashback.
Yeah, okay. Yeah, I think we
But I'm
did.
going to get my calculator out. 'Cause
That's
I'm
okay.
just-
That was-
46.
Get comfortable. Get comfortable. I'm good with it.
I just got to do it my own way.
That's okay.
And then
That's
I get
okay.
there, right? So, okay. So just,
I'm all right. I'm all right.
This is the first one you pulled out your calculator.
I could present a cash-only budget, but then I would be violating general accepted accounting principles, and I hate to do that.
okay. I get it. I get it.
Okay.
The subsidy in your budget is 46, 112, 100, right?
Yes.
But you're gonna, on your cash flow, setting aside the lease payment, you're gonna be $3.9 million over, right? You're gonna have $3.9 million extra
Better,
after
setting
you
aside the
you
lease.
get if you got the $46 million subsidy, right?
Correct.
And then, but you actually have $2.7 million left over, so you do 46 minus 3.9 plus 2.7, and you get 44.92, right?
Right. That's
Okay.
right.
That's it.
I know it seems convoluted because there's
No, it
cash
is.
and
It is
non-cash.
convoluted.
I know.
There's
Not
a
to
seam
us,
about it.
right? Not to us.
I had to pull out my calculator on it, too.
All right. I understand.
If it makes you feel any better, we do share our bank account information, each cash flow sheet as well.
Yes, they
So
do.
we don't have any money hidden.
My ability to understand it equates to my ability to explain it. So
Okay.
that's the reason I need to
Fair
understand
enough.
it. So, all right, well, thank you. That's really the only question I had.
I'm okay. Yep.
All right. Thank you very much.
Thank you, Mayor. Thank you.
Appreciate your comments.
Nice to meet you.
Nice to meet you.